Hello students, this is Professor Lopez and we're back with another pharmacology video. Today we are covering beta blockers as well as the most common components that pertain to nursing students, such as the side effects, the mechanism of actions, and the nursing implications that we must assess for and educate our patients. Prior to us diving into the content, please feel free to like, comment, and subscribe below as I will continue to put out content for nursing students in pharmacology. For beta blockers as well as most cardiac medications share a commonality in their suffix. Beta blockers end in LOL. When you see this suffix LOL, I need you to think beta blockers. Examples include atenolol, propranolol, labetalol. As you see, they all end in that suffix lol. Now with beta blockers, unfortunately, there is two specific subcategories of beta blockers. That is either selective beta blockers or non-selective beta blockers. To make this more simple, selective beta blockers specifically target beta-1 receptors. Non-selective beta blockers target specifically beta-1 and beta-2 receptors. Now you may be asking, what are beta-1 and beta-2? I have a simple trick to assist you in memorizing what do each receptors do. For beta-1 receptors, I want to think you have one heart. Beta-1, one heart. Beta-1 targets the heart. Now beta-2, think you have two lungs. It targets both the heart and smooth muscles such as the lungs. This will make a lot more sense when we dive into the specific side effects. Now again, you guys are probably asking, there are so many beta blockers, Professor Lopez. How do I memorize the list for both non-selective and selective beta blockers? If your beta blocker begins with the letter A through N, it is a selective beta blocker. Examples include atenolol, metoprolol. As they end in that first letter before the letter N, they are selective. Now, if your beta blocker starts with the letter O through Z, that is a non-selective beta blocker, such as propranolol and sotalol. Now that we understand the difference between a selective and non-selective beta blocker, let's talk about the mechanism of action. What do beta blockers do to achieve their therapeutic response? Beta blockers specifically, as the name states, they block beta receptors. These beta receptors, to better understand, are normally the receiving receptors for catecholamines such as epinephrine. By blocking the epinephrine from binding to the receptor, we are causing a drop in heart rate, a drop in blood pressure, and a drop in cardiac contractility. This is what provides the side effects that are normally achieved from a patient on beta blockers. So a nice little recap is that beta blockers block beta-1 and beta-2 receptors, thus causing a drop in heart rate, blood pressure, and cardiac contractions. The indications, why do we give beta blockers to specific patients? So number one, this is an anti-hypertensive medication. So this is a medication used for hypertensive patients. We as well give this to patients following a myocardial infarction. This medication specifically reduces oxygen demand to the myocardium, thus promoting a more stable environment for individuals with cardiac damage. We can also use this for angina and atrial fibrillation. Some cardiac uses include headaches and tremors, specifically tremors associated with hyperthyroidism. I would say testing-wise, the two most commonality side effects you're going to see is hypertension and post-MI care. Side effects. What side effects can we expect with a patient on beta blockers? The first side effect I would like to warn you guys on is a reduction in heart rate. Since these medications block beta receptors, they cause a drop in heart rate. This heart rate below 60 is a red flag for nursing exams. So if that heart rate is below 60, you are to hold that dose. The same goes for the blood pressure. This is a hypertensive medication. These medications can drop the blood pressure too much. So if you notice a blood pressure less than 90/60, you are to hold that medication. The next most common side effects in relation to standardized exams is bronchoconstriction, specifically those non-selective beta blockers. Remember, they target beta 2. We have two lungs. Beta 2 targeting beta blockers can cause bronchoconstriction. So we are to avoid this medication in COPD and asthma patients. Lastly, these medications can mask signs and symptoms related to hypoglycemia. As we know, signs and symptoms for hypoglycemia include tremors and tachycardia. This specific medication can mask those symptoms, thus making hypoglycemia go undetected. The last and most important side effect is because this medication has a black box warning. As we know, black box warning are proven and lethal side effects. This is that by abruptly stopping beta blockers, patients can exhibit signs and symptoms related to rebound tachycardia and rebound hypertension, potentially lethal. So you're going to educate your patients that you cannot abruptly stop beta blockers. Now that we understand the side effects, let's talk about some contraindications to this medication. Individuals that are potentially going to take beta blockers. Direct contraindications are COPD and asthma patients, individuals with sinus bradycardia. As we know, individuals with a heart rate less than 60 cannot take beta blockers. Individuals with second and third degree AV blocks. And lastly, a very hot targeted disease process is heart failure. Individuals with heart failure, specifically worsening heart failure, cannot be put on beta blockers. Some nursing indications to highlight. As a nurse, you're going to assess heart rate and blood pressure prior to administration. You're going to assess for chronic health history for disease processes such as diabetes and COPD. And lastly, we're going to reinforce the potential and black box warning for reflex tachycardia and hypertension. That concludes beta blockers class. Now, as always, we are going to do two NCLEX style questions. One being a regular multiple choice with only one potential answer, and a select all that apply. A select all that apply that you will be seeing not only on your nursing school exams, but on your NCLEX. So I highly recommend you become familiar with these. As always, I would recommend you pause the screen and digest the question. Make sure you are choosing an answer unrushed, and then we can verify the answer together. The first question, and this is a sole multiple choice answer. A client who experienced a myocardial infarction is placed on a beta blocker. Which of the following medications below would be included in this medication classification? Is it A, lisinopril, B, metoprolol, C, hydrochlorothiazide, or D, verapamil? If you chose B, metoprolol, you are correct. That is because A, lisinopril, that is a ACE inhibitor with the pril suffix. C is hydrochlorothiazide, which is a thiazide-like diuretic. And D, verapamil, is a calcium channel blocker. The last question we will do together is a select all that apply. And this question reads, a client who suffers from hypertension and headaches is prescribed propranolol. The nurse would educate the client on which side effects associated with this medication. Is it A, vomiting, B, tremors, C, masking of hypoglycemia, D, bronchoconstriction, or E, bradycardia? Again, pause the screen, students, and digest this question. break each choice down into its own individual question and cross it out if it doesn't apply. The correct answer is C, D, and E. Let's go one by one now and dissect each choice. So for beta blockers, a side effect for them does not include vomiting. So vomiting would not be a potential answer. B, tremors. This is not correct because as we know, this medication actually treats tremors. It is a treatment choice for disease processes such as hyperthyroidism, which can cause tremors. C, the masking of hypoglycemia. This is a correct answer as it's one of the big red flags for beta blockers. D, bronchoconstriction. As we know, non-selective beta blockers, specifically ones that target that beta 2 receptors, can potentially cause bronchoconstriction. And E, bradycardia. Being a medication that causes bradycardia, we need to be very cognizant about monitoring for further bradycardia. With that completed, class, that concludes our beta blocker presentation. If you enjoyed this content as well as the breakdown of this medication classification, feel free to comment below a specific medication you would like me to further dive into. And as always, I would highly appreciate if you could like and subscribe as it assists me in continuing to put out content for you guys. I'll see you guys next time.